The affluence of Silicon Valley is not only reflected in its high-tech companies and world-class amenities, but also in the innovative technologies and lifestyles that it births every day. Innovative technologies and companies here have revolutionized the way we live and work, setting trends and launching new lifestyles across the globe. Despite the glitz and glamour, Silicon Valley grapples with severe poverty marked by hunger and homelessness. These disparities are evident in the stark contrast between the high-tech companies and the struggling individuals who form the backbone of the community, often living in poverty. Amidst the unseen shadows of hunger, poverty, and homelessness, we encounter an organization like West Valley Community Services. With a mission to unite the community in fighting hunger and homelessness, West Valley Community Services stands as a beacon of hope. Their vision is a community where every person has food on their table and a roof over their head. In this program, our mission is to delve into their initiatives, their impact, and the stories of resilience they inspire. My name is Ranjana Mehra, and today I'm going to talk to Sujata Venkatraman, the Executive Director of West Valley Community Services, to learn about all the ways they fight hunger and poverty to provide relief and hope to the people facing harsh realities. Welcome, Sujata. Let's begin. When was West Valley Community Services established and why?
West Valley Community Services was established in 1973. So this year we are celebrating our 50 years. Initially, the organization was called Cupertino Community Services because it was founded in Cupertino by 3 public nurses who saw a need in their community. They realized that hunger was one of the needs that was showing up, and it was at that time a farming community with apricot orchards, and they started collecting food and started operating a food pantry from their garage. From there, this organization grew, and then we were in schools, we had a community center where the pantry was, and eventually the board created a capital campaign and bought the permit and approval from the city of Cupertino. The fire department gave us the land lease, very nominal, and the establishment that we have right now on Vista Village, which is 10104 Vista Drive, Cupertino, happened.
Congratulations on your 50th anniversary. We just celebrated our 40th anniversary. So this is a big year for you. Sujata, if I meet someone on the street who is in need of help, should I refer them to you? How does it work?
So a couple of options. In the county, we are 7 emergency assistant network. So based on where the client is, of course, you can give our name, but the other resource is 211. 211 is a centralized system. If you as a community member call, you will know which agency is providing that service. And also that information can be given to the community member who's in need as well. And they can call 211 to find out what resources are there in the community.
What if they do not have a phone?
As a community member, you can do that. Many libraries allow for them to make that call, or you can refer them to us, and we can either help them if they are in our area, or we can refer them to the right agency.
All right. So what services do you offer, and who are your main beneficiaries? And what is the eligibility criteria?
West Valley Community Services offers basic need services like free grocery. So clients are able to come to our market and get weekly groceries. This is West Valley Community Services market. We are open Monday through Friday and we give out free groceries. On this side of the aisle, you're looking at dry goods. We also have signs in different languages. We have English, Spanish, and Chinese signs based on the majority of clients who access our services. And as we come here, these are more cans and beans that we put out. We also put recipes out for our clients to use. We have gluten-free section, and here is bread. Here are our refrigerators where they can come in and pick whatever they want. As we go closer, it's the meat section, and we have everything labeled. The kinds of different meats and proteins that we have. Here you see all the fruits. Again, easy to reach, very visible for our clients. And here we have our personal hygiene. We have found out that many clients do not want to ask for Depends or even feminine hygiene product. So we have it on display. And again, this is another way for us to treat them with dignity and respect. And the last section, we put out the sweets and the desserts, and they get an option to pick these out as they are heading out. Sometime we'll have like flowers, depending on the season, and here they check out, they meet a volunteer, they thank them, and then they head out to their cars. We also provide emergency financial assistance in the form of rent and utility support. This helps our clients to prevent eviction and a utility shutoff. We also offer case management to help our clients navigate the social services system so that they can get public assistance in the form of food stamp, get assistance with tax, like free taxes we do, reinstate their medical or other social services benefits. We also offer supportive and housing services for our unhoused. West Valley Community Services also owns 28 affordable housing units. 24 of them are 1-bedroom, 2-bedroom attached to our office, just behind our office. And then we have a 4-plex units that's close in Cupertino for families with children.
Oh, so the units, the gray painted units,
correct,
behind your West Valley Services headquarters, they are places where you rent to,
yes,
okay, low-income people.
So those are part of the below market rate housing program that the city of Cupertino runs with another provider called Rise Housing.
Okay. So how do you identify the community needs for food and housing assistance and assist clients in achieving self-sufficiency? Also, what measure do you have in place to prevent individuals from abusing your services?
So the clients that we serve are families with children. They are young adults. They are our older population and the unhoused. Anybody who is below the 275% of the federal poverty qualifies for our services. And I'll give you an example of what that means. That would be a single person making about 40,000 annual income.
I see.
Or a family of 4 making 80,000 annual income. How do we identify our clients? Many of our clients are coming to us from referrals from schools, from the city. Hospitals refer the clients, even public safety. So if someone goes out to help a client, then they see that the client is having a need, they come to us. We are also in our community doing surveys, focus group. We have our lived experience advisory committee of our clients who also advise us on what are the community needs and what services we should be providing to help support them.
And how do you prevent abuse of your services?
Because we have an eligibility criteria, when a client comes in, we ask them to fill out demographic information. We ask them for income proof, and they are able to provide us that income proof. Many a time, if families qualify for social services, then they are in the extremely low, very low income criteria, and they automatically qualify for our services.
How do you prioritize which individuals or families receive your services, and what measures do you take to protect your clients' privacy?
There is no like a demarcation of who gets it. We are a community need organization, but majority of our clients qualify for our food service. So they can come and get weekly groceries. After that, if they have a need, for example, that they lost their income or had a medical emergency, or even just like they had a car repair and they're unable to pay rent, then they can contact us and we are able to provide rental assistance or utility assistance to prevent eviction. So in all our services, we are trying to make sure that we are preventing, and we are also making sure that our clients are not displaced from our communities and they are staying in our communities and helping the community grow.
I was just wondering that somebody who has like 2 kids and somebody is just an individual, would you prioritize the person who has a family?
Their needs are very different. So if it is a family with children, we try to work with them a little bit more. Maybe we have to engage the schools now to make sure that, the family is supported. So the type of services they get may differ. The higher the client is in a crisis, we do provide case management services. So their need for having a case manager work with them is always higher. 80% of our clients fall in the extremely low income category, and majority of them have a source of income. So they are all working in the community. They have service jobs, Uber, Lyft drivers, or they are working in salon, our service industry. It's just that they need this additional assistance to be able to maintain their housing, to be able to live in the cities that they live and work in the cities that they want to live.
So there is a case manager, there is somebody monitoring all the time.
To your other question that you asked is, what are the documentation we are asking is very simple. It's like their lease, where they live, it's a PG&E bill, and their income documentation that gets them to qualify for our services. Anybody who's coming to us when they give us their information, it is all safeguarded. So we have a website we put it, but it is safeguarded with all the privacy control. Whatever we ask them, we ask the permission from the clients to make sure that, that when we are saving those and keeping it, they always give us the permission who to share it with. So that's how we safeguard their privacy.
Who are your main contributors, like your volunteers or service staff, and how many people are involved?
So West Valley Community Services is operated by a board of 14 members who are community members who live in our cities, who are the same mission and are working with us to fight hunger and homelessness. We are a staff of 35. We are a very diverse staff. And on a weekly basis, we have about 60 to 70 volunteers who help out with different operations, our market, our front desk. They also do what we call as our grocery rescue. They go out in the community and bring groceries to our market operation.
All right. What partnerships do you have and how do they benefit the community?
So West Valley Community Services is part of an emergency assistant network. We are 7 of us in Santa Clara County. So we all work together in a coordinated effort because all of us have our service area. So West Valley Community Services works primarily in the West Valley region, and the cities that we work in are Cupertino, Saratoga, Los Gatos, West San Jose, and the mountain areas which extends up to Redwood Estate. So we are the community organization or the safety net organization for the West Valley cities. But there are others who are in other areas of Sunnyvale, Mountain View, East San Jose, and even South San Jose. And we try to coordinate those efforts with those organizations. We work with schools. We are surrounded by schools in Cupertino, Saratoga, Los Gatos, and West San Jose. So we work with all the school districts to help us connect the clients who may be in need. We are surrounded by 2 community colleges, so we work with those community colleges and we provide the services. Hospitals, faith communities are our other partners who help us connect with our clients.
What I was trying to get at is whether there are organizations like Second Harvest, Food Bank, and all. So those are also your partners?
Sure. Yeah. So 60% of our food comes from Second Harvest Food Bank. And the rest, we have partnership with local stores. around our cities, and we also do food drives, and that's how we create these partnerships for all our services.
Okay, so this is a nice segue into my next question as to what types of donations do you receive and how do you manage them?
Sure. So our primary service that we offer is food. So many of our food drives that we do, we ask the community to bring us food. So we do it all around the year. Many a times during the holidays, these food drives pick up. But this is a reminder to the community, hunger is in our community all throughout the year. So we do educate the community to make sure that not only during the holiday time, we need food round the clock. So the food that we ask for are ready-to-eat meals. We ask for cereal, oatmeal, rice, beans, anything packaged in smaller, dry goods, non-perishable items, we are able to take in. So the community ask is, please continue to donate to organizations like us, West Valley Community Services, and also to the food bank because the food directly comes to us in many ways.
So when I visited West Valley Community Services specifically for this interview, you showed me a lot of hygiene products and other things that I would not think of, but those things too, people donate them?
Sure. So the other ask is, especially for the unhoused population, is hygiene. And what we typically ask the community is feminine hygiene products, diapers, toiletries, and even simple things like ponchos, flashlights are much in need. And during the summer months, we ask for a water bottle where the water can be kept safe, and socks for the winter months, and jackets. Lightweight, so that our unhoused clients can carry them in their backpacks. So one way, these are the in-kind donations. Cash donations also help us to run the operation. In many ways, we do many events in the community. The big one, we call it our Chefs of Compassion. It is our annual fundraiser, and this year is our golden anniversary, so it will be big. And we invite the community to be part of that, and that exposes them to the work we are doing, the impact we are making, and also helps us to raise money. So it is our benefit gala.
Every year, Silicon Valley's top chefs must compete in a head-to-head challenge, taking items from a food pantry and creating fine dining cuisine. At West Valley Community Services, each chef is given a course. With 10 minutes on the clock, they must create a recipe based on the ingredients found in the food pantry. They will be judged on their skill, their knowledge, and their creativity at a full-scale event by an audience of hundreds. Who will become this year's Chef of Compassion?
During the months of like August, we do our backpack drive. That is another way that community members sponsor the event. They do monetary donation. During our holiday program, we ask community members to adopt a family to make their wish come true. And most of the wishes are for personal items or a household item that the family is looking for. And during Mother's Day and Father's Day, we also tend to raise money. And these money that we raise is primarily to support families who have very unique critical need. Let me give you an example. I had a family who was unhoused and they moved into housing, but they didn't have money for buying basic cooking utensils. And so we raised this money during Mother's Day and Father's Day to help support that program. So that's, there was another family who was unhoused, didn't have mattress. And so this kind of fundraising, small event fundraising that we do, help us to meet critical family needs round the year for different purposes.
Okay. There is a question in the community. I see it all the time on Nextdoor. Why have homeless encampments grown in California, and how do you address this issue, and what seems to be helping?
In California, we are facing this problem primarily because there are not enough affordable housing. Cost of rent is very high. So if you have looked at studies that even UCSF has put out, one of the primary reasons that someone becomes homeless is because their rent increased and they got evicted, and they only had like 30 days to figure out housing, and it's not available. So limited affordable housing, raising cost of rent, and just cost of living is going up. What is also not happening is income is not going up at the same level as the cost of food and
Cost of living.
gas and living is increasing. And that's creating an impact. Someone, when they become homeless, they are not able to find housing immediately. We have in Santa Clara County about 9,000 people on a given night out on the streets. And the reason is we don't have enough shelters. We don't have enough transitional housing. We don't even have enough affordable housing to move them into faster. So what they land up happening is they're either sleeping in their car or they land up sleeping outside. I just want to tell the community members it's not their choice. Many of these clients want to be housed fast enough, but the situation that is out of their control is there is not much affordable housing with their service sector job. If income is so low, they're not able to find something fast. With eviction on their records, many landlords also do not want them. So this creates dynamics of finding housing and getting out of the streets and being housed.
And how do you identify new immigrants and help them? Also, what outreach strategies do you use with them? And are there any remote services available?
We are an organization that is open to anybody. So we do not ask for their immigration status. We are just open. But many a time, families who are coming new to the community get connected to the faith community. Because of our relation of 50 years being in our communities, we are very much connected to the faith communities and we work with them. Primarily for someone who's new to the area, we try to make sure that they understand West Valley Community Services and also what other benefits are there in the community, and we try to connect them. So whether it's schools, it's social services, and then of course our case managers work with them to create a plan for stability.
So when I visited West Valley Community Services to talk to you, I saw in the front, I was bringing lemons to donate because this is how I learned about West Valley Community Services, summer fruit coming and I want to donate. So there were grab and go bags and all. So my question is, what do you do with people who cannot visit just because they have a day job? How do you get to them? Because of inaccessibility, they can't come, but they need your services. What do you do?
So two ways, and you rightly said, we always keep these ready bags. So if someone is coming to us, they cannot wait in line, we always have food for them. The other way that we are very unique is that we are open late on Thursdays. We are open on a late shift, which starts at 5 o'clock and ends at 8 o'clock. And the reason to be open late on Thursdays is to meet the needs of families who are working. We totally understand how that, the difficulty with transportation, picking up their kids. We try to be open for them. The other thing that you talked about, accessibility, and we recognized that about 7 years ago, and we created our mobile food operation. This is called Park It Market, and it goes to the community. So that way a senior who is homebound can get food. A senior who does not have a car can still get food through our Park It Market. We serve about 9 locations. We have West Valley College, De Anza College. We have about 4 elementary and middle school and high school that we serve, and 2 affordable housing units in Saratoga and Los Gatos. This is a food truck converted into a grocery pickup. Clients can come in and they can pick up whatever food that they want. This side is the refrigerator, and we keep the refrigerator goods in here. It has a place for someone to meet with a case manager. We have case management area as well. Just not being in the office is not where you get services, but we are also in the communities providing these services.
I see. What are your plans for future growth and expansion, including job placement, low rent housing, healthcare, and tax filing assistance in it.
So many of this that you're talking about, we either offer or refer. My goal is in a few years, we are able to get another mobile van that can go out in the community, serve out of our schools, because that's where we have found the success is when we are in the community, we are able to provide the services and clients are also able to access our services. Other things that you're talked about are things that are in works. We are looking at finding partners and providers who continuously work with us to enhance the services that you talk about, like job training, employment assistance, and even as simple as providing benefit assistance or mental health. So we are always looking for new partnership, and we are working with the community, our cities, and even the county to help us provide these services.
Healthcare also?
Healthcare referrals, yes.
So with hospitals you have
With hospitals, yes.
All right. Okay. Do you have specific challenges that you're facing in addressing homelessness, poverty, and self-sufficiency?
Of course. As you know, we are a most expensive state, and Bay Area also with cost of living is very expensive. Where we feel like there are so many external factors that we don't have control on. One is income. We have to think about raising income. Minimum wage is 17. We need to start thinking about what that would be if we move to a living wage where people are not spending 80% of their income on rent and they have money for emergency or for some saving. Another thing is affordable housing is needed, so that more affordable housing we have, more families can have housing stability. We can prevent eviction and eventually prevent homelessness. The other challenges is they don't have cars or reliable cars, and they are dependent on public transportation, which in some of our areas may take hours to get from one place to another. And lastly, I would say affordable childcare. We are working on advocacy. We are trying to raise awareness on lack of affordable housing, on how you can help break the cycle of generational poverty. So engage with us. We do educational workshops on how to do public comments. We engage with the city council, have conversations. We also engage with our lived experience clients who have experienced this, and we bring them together with our community members, and that's another opportunity for the community to learn about how they can help at a policy and systems level.
Recently, there has been a change in leadership at the West Valley Community Services. Could you shed light on this transition, and how did you ascend to the position of Executive Director at West Valley Community Services?
Before becoming the Executive Director, I was the Associate Executive Director. And last year, we went through the transition. My ex-boss, his name is Josh Sello, he decided to move on to another organization. And I had been talking to him about my own professional development, and I wanted in a few years to be leading another organization. And it just so happened that West Valley Community Services, we had this opening, and the board asked me to take on this role. So I feel very honored and humbled that I'm leading an organization that I had been for a long time, and the leadership and the mentoring that I had received is really helping me move into this transition easily.
You have experience from India also, right, in social work?
Correct. So I did my master's in social work from India. I worked in India with different organizations, primarily doing training and curriculum development for rural schools. So we really were looking at creative ways of using drama, art, and also creative curriculum to help kids interested in school, especially girls interested in education.
Thank you for coming here, Sujata, and talking to us and letting us know about West Valley Community Services.
Thank you so much.
Sure. We've just been in a conversation with Sujata Venkatraman, Executive Director of West Valley Community Services. We encourage you to visit their facilities in Cupertino. Your contribution, whether financial, in the form of goods, or your time, can make a significant difference. Thank you for watching. This is Ranjana Mehra. See you next time.